The following segment is sponsored by Moda Health.
Welcome back to AM Northwest. We all know that staying healthy is so very important right now. But are you giving your teeth the right care? Here to share how dentistry is going virtual, we welcome Vice President and Chief Dental Officer for Moda Health, Dr. Teri Barichello. Good morning, Doctor.
Good morning.
So first of all, are people coming in for cleanings and that kind of thing right now?
Yes, thankfully all services are back and green lighted. So cleanings and routine care is all ready to be scheduled.
And what do you have in place?
Well, at most practices, there are some new protocols. They may do a pre-screening before you come into the office, and there may be some new safety and infection control measures that you may notice when you go in. But after that, it should really feel pretty normal.
Now, for folks who aren't able to go into an in-person visit, are you able to use like teledentistry kind of thing?
Yeah, so that's one of the really great measures that came out of the pandemic, if you can find a silver lining. And so a teledentistry visit is really easy. It's just using your phone or email or even FaceTime. One of the things that we did at Moda and Delta Dental is we launched a portal for our members to help facilitate that visit. So it guides someone who's maybe having an issue through a series of questions, and you can upload photos, and then it connects you with the dentist. And the great thing about this, it really allows the dentist to triage and determine how urgent is an issue. So during the shutdown, only emergency services were allowed to be done. So it allowed dentists to really determine what warrants needing an in-person visit. And, you know, teledentistry is going to stick around. There's a lot of great uses for it, even now that things are back to normal. So there are a lot of things that patients can have happen and maybe they have concerns about, and they can easily have this type of interaction telephonically or by a live video feed. And can keep them from having to actually go in for an appointment.
So what services would you offer virtually that way?
Yeah, you know, it's a good question because dentistry is such a hands-on profession, obviously. So it's primarily exams and consultations, but there's still really great value for that. So I'll give you an example from when I was in practice. A really common occurrence, especially for parents of young children, as they are starting to lose their teeth, a lot of weird things happen, and it can be really alarming for the parent. You know, there's some inflammation. The teeth can come in with like basically rows of teeth. And if you've not had kids go through that, that can obviously cause a lot of concern. Well, that's the type of thing that can be, you know, a dentist can provide advice over, you know, much like you and I right now, and prevent the visit.
What about back to school? Oftentimes, right before they go back to school, kids visit the dentist. What are you suggesting at this time?
Absolutely. It's so critical that we maintain our routine care, especially with kids. You know, dental disease, gum disease, cavities, it doesn't stop because there's a pandemic. And with kids, having that routine interaction and those preventive visits can help you know, identify things early. It's so much easier to treat it when it's early. And then also with the cleanings and the fluorides and et cetera, we can help stop decay and prevent any you know, surgical visit at all.
Yeah, because I would think kids' issues, they move fast, don't they?
They develop, you know, kids' teeth are different than your adult teeth. So you're absolutely right. A cavity that gets started in a primary tooth or baby tooth can actually really progress very quickly and become and be much more destructive.
Right. All right. Thank you so much, Doctor. We want to tell folks, if you'd like to find out more, contact Moda Health. We'll have a link on our website at KATU.com. Dr. Teri Barichello, thank you very much. I appreciate it. And we'll be right back with more AM Northwest. Don't go away. Thanks, Doc.